I solemnly swear to exercise in all loyalty, discretion, and conscience the functions entrusted to me as an international civil servant of the World Health Organization, to discharge those functions and regulate my conduct with the interests of the World Health Organization, only in view and not to seek or accept instructions in regard to the performance of my duties from any government or other authority external to the organization. God may help me. Thank you so much. Thank you.
J'ai maintenant le plaisir d'inviter.
Now have the pleasure of inviting the Director General, Dr. Tedros, to address the Health Assembly. You have the floor, Dr. Tedros.
Very difficult to express my word. Mr. President, thank you so much indeed. This is overwhelming. I'm really grateful and very humbled for your confidence and trust. It was not just today. During my nomination, all regions have nominated me. Afro, AMRO, EMRO, Euro, CIARO, WIPRO. Countries from each region have given their confidence and trust during the nomination. And I was told that this is the first time a candidate having more than one nomination, a total of 27 from all regions. So it started then, and today also I'm really, really overwhelmed by the support. Thank you so much. Your trust. But this recognition is not just for me. By and large, I even believe it's a recognition for the whole WHO family, my colleagues, my team. I will tell you a story. about how the pandemic started. It was December 31st, 2019, when our office in Beijing detected a report in Wuhan city, China's city's website about a new disease of unknown cause, similar to pneumonia at that time, which is not yet known. And then our office immediately passed it to our regional office, the country office, from regional office to the headquarters. It was December 31st, and it was the eve of a new year. And nobody said in all levels, it can wait. This is New Year Eve, we have to have a break, or we have to have rest, we have to have time with family. They didn't say that. They did their job, even if it's the eve. But not only that, on New Year, they continued checking about this new disease, meaning January 1st, that's the new year of 2020. By the way, I got the message on December 31st itself, so they alerted me. By the way, that was the first time I had a break since I became DG, and that's the last one. Until now, I didn't take a break. It was immediately after I returned from a 2 weeks break. Maybe the break was meant for this, because there was a big deal ahead of me. Then January 2nd, they processed January 1st, and on January 2nd, they verified that it's a new disease. And then, of course, alerting the member states, and other things continue. The reason I'm telling you this story is WHO is full of staff who know what their duty is and do it without any reason, whether somebody is watching or not, do their job well. That's why on the eve, they didn't say it's the eve and we will have a break. On January 1st, they didn't say it's a new year and they want to have a break. And until January 2nd. It's that kind of dedication and commitment that gave me the energy at the start of the pandemic and lasted through, because of the confidence in our staff. That confidence. And today, this support, full support, confidence is for the whole WHO, and I'm really proud to be WHO. And that's how I take it, not just personal. This is for the whole team. And the other thing maybe related to that is, some people say, ask us, even this week after this in-person meeting, Tedros, you were under pressure, the whole WHO. It was difficult more than 2 years. And there was serious critics or attack even from many quarters. How did you manage? You must, maybe many of you have thick skin. Then my answer is no. Whatever skin you have, however thick it could be, it can be penetrated. But the reason we tried to do our best with calm was, whenever a critic comes, or even insult or attack, we focus on what the message of this person or these people or the people who are talking is. What's their point? Even when someone is talking to you angrily, that person might have a point. Maybe he's angry and saying it with some unnecessary words, or maybe unnecessary energy or anger, but that person may have a point. Or the group who is saying something about WHO may have a point. So what we do is, we try to check the point and channel our energy towards addressing the point, the issue that somebody is raising. Even in the middle of largely serious attack which is completely unacceptable, covered with rubbish, you may find a point. There may be a point that we need to understand and try to address it. So you will have always energy to address if you focus on the point which is being raised or on the issue. We didn't want to take it personally, we don't take it personally, and we don't channel energy to be defensive, but to focus on the point and on the issue. I think that helped us to calm down, focus on the issue, and you can always find energy if your focus is on the issue and on the point. And that's what I would like to share again on how me and my colleagues, were addressing these difficult times and stayed together, united, and focusing on the important issue, on the most important issue, and move forward. And I have seen all my colleagues working very hard and in good faith, and focusing on the issue, on the point, addressing that, nothing else. And for that, we always had energy. Just wanted to share that, and again, to appreciate the WHO family for their hard work and for focusing on the issue and serve humanity. And then the other part maybe I would like to raise is the priorities. I don't want to take your time on this. We have already presented this. It's to promote health, keep people healthy. That should be at the center. Managing disease should not be the center. Of course, people will be sick. That has to be managed, but we have to focus on promoting health. That's number one. Number two, we have to focus on primary health care. The center of universal health coverage, its foundation should be primary health care. That's number two. Three, of course, on emergency preparedness and response. But the third one, the priority on emergency preparedness, the third priority is dependent on the first two. Focus on health promotion is prevention, and focus on primary health care you can provide services, but at the same time can make your emergency preparedness a response robust, and that focuses on prevention. And I hope we will be able to prevent the next pandemic or manage it as efficiently as possible. Then the fourth priority is enablers, science, innovation, data, digital health. And then, of course, the last one is to continue to strengthening WHO, continuous improvement. And this pandemic has been very unprecedented. And many lessons that we should learn, and we're learning. But at the same time, we cannot just pause, learn, and implement. We have been building the ship as we sail. And you know about the ACTA, which we initiated immediately after the pandemic started. Then the WHO Academy, the Logistics Hub, the Bio Hub, the UHPR, mRNA Hub, the Biomanufacturing Training Hub. All these are being executed as initiatives because of the lessons we have learned. And instead of pausing to learn, we're saying, while learning, let's implement, meaning while sailing, let's build the ship. And the reason I'm raising this is all the changes we're making, one, as you asked, it will be country focus. All roads should lead to countries, and working for WHO focused on country priorities. And the other element is transparency and accountability when we do our job, be it the priorities or the initiatives we have based on the lessons learned and additional lessons that we will be learning, we'll keep learning. Then I think this is number 5. I would like to really thank you, because not only you're re-electing me, but you're also giving me an incredible gift. Among many things, I will mention only one, the gift during this assembly is focusing on. That's the sustainable financing, both the assessed contribution and the replenishment. This will help us to implement the priorities which I have already outlined more effectively and efficiently. As you know, our budget is based on voluntary contribution, less than 20% assessed contribution. You know this. This more than 80% voluntary contribution means close to 3,000 grants or pots. Imagine managing close to 3,000 pots. Some of the grants could be $500,000 or even $200,000 US dollars. You have to prepare a plan for that, then a monitoring framework you prepare, then you have to implement, then you have to report. That's very confusing. So in leading our organization, especially if we don't focus on programs and we're managing this many grants, but at the same time, many of the WHO leaders wasting their time asking or raising for money, imagine how that can influence the program. So the gift today is you're helping us. Of course, it will take some years until it's fully implemented, but you're telling us to focus on the programs and that the funding will be taken care of through two major pots. That's the assessed contribution, the replenishment, and then, of course, the voluntary contribution can continue, but as a minor contributor. But when you do that, not only you're helping us to focus on our program, you're ensuring the stability of the organization. Because many of our staff have consultant contracts. Many of our staff, they have 2 or 6 months contract. Do you know that we have staff who cannot even rent a house in Geneva because their contract is not enough to guarantee any, contract with a landlord to rent a house, because they need some security, and the landlord will expect you to stay for some months and to have that contract based on the length of your, the landlord's contract based on your work contract. You may not believe it, but we have staff who stay with friends. It's true. Because it's 2 months contract, nobody will even rent them a house. 6 months contract, they will not. And not only that, since they're unstable, there is uncertainty, and they cannot stay because they have to find other places where they could have some sort of certainty and security. And we lose talented people. And that's why we need stability in the staff to retain our talented people to do our job in a better way. So then the reason I said it's gift is because it brings stability to our staff. And third, that the flexible funding means more resources can go to the countries. And that's what you asked us. More resources to countries, more support to countries, and of course to regions, if it's flexible. If it's earmarked, could be earmarked in headquarters, we can't even move the money. But I'm raising this as a gift which is very historic, that will be a game changer for WHO. And since you're deciding on this during this re-election, I would like to really thank you wholeheartedly. And merci beaucoup. Thank you so much indeed. Thank you. And then our aspirations as human beings is the same. I have seen it during my travel to many countries. I have visited many of your countries. You look into the eyes of people, people always want peace. They want to be healthy. They want progress, development. That's it. Maybe it makes very sense to me because on Sunday I shared my story. Not only I am a child of war, but I come from a poor family. And during that time, actually, when I was very young, when I was around 7 or 8, I also lost my younger brother due to, now my mother tells me that something similar to measles, that he died, my younger brother, but he could have been saved. The reason I'm telling you is I was spared, just pure luck. It could have been me who could have died more than 50 years ago. But instead was my brother. So luck brought me all the way here. If you see it in terms of exposure to disease and poverty. That's why I think last time I was managing to swallow, but so exposed to war as a child, exposed to death in your family, especially your younger brother at early age, and then being from a poor family, the combination is bad. That's why when I visited Ukraine, when I saw especially the kids, I felt what I felt. You may not believe it. When I see the kids, it was the image from more than 50 years ago that came to my mind, so visible, so haunting. The smell of war, the sound of war, the image of war. I can't even understand. So visible, so clear. And it happened many years ago. That's what I don't want to happen to anyone. So I hope peace will come. So March, if you remember March 2020, at the height of the pandemic, when we were all in fear, I said 3 lines that my able speechwriter, where is Simeon, wrote. And I will read it again. This is March 2020. I think March 10, 11, around that time. I remember them because it was also from my heart. Let hope be the antidote to fear. Let solidarity be the antidote to division. Let our shared humanity be the antidote to our shared threat, because we have, as humanity, shared threats, as we have already seen. These are the 3 lines I said. Today, I will add one more. Let peace and understanding be the antidote to war. Thank you so much. Thank you for your confidence. Thank you. Very humble. Thank you. Thank you. Thank you very much. Thank you. Thank you so much. Thank you.